So, what happens when a doctor's medical plan is guided just as much by faith as it is by science? Well, today we're going to dive into the really unique philosophy of Dr. Nidal Abarati. She treats infertility by blending modern medicine, psychological care, and a really deep spiritual framework. Let's break down how these three things actually work together.
To really get a handle on her approach, we're going to follow her own way of thinking. We'll kick things off with the results she's so proud of, and then we'll unpack the three pillars that she believes make it all possible. The science, the psychology, and the faith. And finally, we'll see how she pulls it all together to create her own unique definition of success.
Everything really starts with the results. As Dr. Abarati looked back on her year, she wasn't just seeing clinical data. Nope. She saw a year of what she calls great achievements. And for her, that's not about numbers on a chart, it's about the lives she feels she's completely changed.
And this is really key to how she sees things. She doesn't just see a patient, she sees the years of emotional weight they're carrying, from all that social and family pressure. So for her, a win isn't just a check mark on a medical chart, it's the end of that suffering and the beginning of a dream they've held on to for so long. So, what's behind these results? Well, the first part of her philosophy is the one you'd probably expect: a solid foundation in medical science and tons of clinical experience. Okay, so the number she puts out there, it's pretty striking. A 70% success rate, and that's across both her in-clinic treatments and her online consultations. As she points out herself, in the incredibly tough field of fertility, a figure like that is, well, it's remarkably high. And she's really open about what that success rate means to her personally. This isn't just data. It's a source of real professional pride, something that comes from her belief that she's making a profound difference in people's lives. So, how does she actually do it? This slide gives us a really clear picture of her medical strategy. It's not just one thing, it's a whole blend of approaches. You've got lifestyle changes like weight management, specific meds like metformin for insulin resistance, supplements, and of course the more traditional ovarian stimulants. She says her international experience, working in both Syria and Europe, helped her build this really comprehensive toolkit. But, the medicine is really only one piece of the puzzle here. The second pillar is where her approach starts to look really different. It's this intense focus on the patient's psychological state as a huge factor in whether they succeed. She's very clear that her background in psychology gives her this unique ability to calm her patients. For Dr. Abarati, emotional support isn't just about having a good bedside manner, it's an actual therapeutic tool that she believes actively helps lead to a positive outcome.
Now, this commitment to psychological care has a real-world impact on her practice, and she's very upfront about it. It affects both the time she can spend with her patients and, well, the cost of her services.
And this is where she explains why her fees might be higher. She's completely transparent about it. The cost is directly tied to the extra time and dedicated psychological care she provides. In her model, patients aren't just paying for a prescription, they're investing in an environment that's designed to give them peace of mind.
And it's that idea of peace of mind that really opens the door to the third and, honestly, the most distinctive pillar of her whole philosophy. This is where the spiritual side of things moves right to the center of her entire approach to healing. Here, she introduces this concept called karamat. It's an Arabic term for divinely granted graces or miracles. It's her personal belief that God gives these gifts to certain people, and she sees herself as one of them, as an instrument for a healing power that comes from somewhere beyond her. And this is such a fascinating paradox, right? We just saw her say how proud she is of her achievements, but right here, she shows this profound humility. She ultimately gives all the credit for every success to a higher power. She sees her skills not as something she created, but as a divine gift she has a responsibility to use well. So how does this actually look in practice for her patients? Well, she lays out a very specific path, and the order here is absolutely crucial. The first steps are all spiritual: trust in God, prayer, reading scripture, giving charity. Finding a good doctor, that's the last step. It's a complete flip of the typical medical journey. Okay, so we've got the scientific, we've got the psychological, and we've got the spiritual. How in the world do these all fit together? This final section shows us how she weaves them into one single idea of what success really is.
This table lays it out perfectly. It shows this kind of dual responsibility in her mind. On one side, you have the doctor's role, doing her absolute best, using all her medical knowledge, providing that comfort and support. But on the other side is the divine role,
In her view, God's will is what matters most, and any success is ultimately a blessing that comes from Him.
And what this all leads to is this deep acceptance that some things are just out of her control. She does everything in her power, but in the end, she acknowledges that the final outcome isn't up to her. In her worldview, both success and failure are seen through a spiritual lens, as part of a divine plan beyond any one person's control.
So all of this blend of the clinical and the spiritual, it leaves us with a really big question to chew on. In this journey of treatment, where a doctor's best efforts are so intertwined with a patient's deep faith, where does one role even end and the other begin? It really makes you think about what healing truly means.